Hello. So today I'll be showing my patient how to properly brush their teeth. I'll initially start by showing them how to brush at a 45-degree angle, just in order to get the plaque or the food or other bacteria that may have, slipped underneath the gums. Because after time, if we're unable to get that, we'll start seeing more bacterial growth and more plaque, while also maybe seeing a little bit of inflammation of the gums, which will not be good in any case. So I'll hand this over to my patient soon, just for her to show me that she understands and, is properly able to show me that 45-degree angle. After she's shown me this, I'll then show her how much toothpaste is recommended, since a lot of times people suggest, is that more is better. Whereas sometimes more is just more of a mess. You can simply go right by with just a pea-sized amount on your toothbrush, and that should be enough for you to brush the entirety of your mouth and still be great. Next, we'll be showing our patient how to floss her teeth. For this, we'll be demonstrating it on a dental form, since a lot of patients like the visual aspect of showing it to them before they initially try it. And to start this, we'll be pulling out the recommended 18 inches of floss. To gauge how much floss you have, you should look for about a foot. And once you've got around that, margin of error, you would pull a slight amount more, and that should be around what you need. So to start, we wrap the floss around our middle finger and then proceed to wrap it around the opposing middle finger. Once you've got it about 2 to 3 inches of length between both your middle fingers, you then grasp with your pointer finger and your thumb. When you've got this grip, you then put the dental floss in between each tooth and work around all your teeth to then go in a up and down motion where you gather all the plaque and all the gunk that may be in between your gums and your teeth. Next up, we'll be placing fluoride trays within the patient's mouth. Now, you'd like to dry both surfaces before you put the trays in, because saliva may end up covering the tooth, stopping the fluoride from completely covering each tooth. You'd like to do this for both lower and upper. And for the lower, we'll be placing foam fluoride in our tray. And for the upper, we'll be placing gel fluoride. We'll be placing the saliva ejector underneath the patient's tongue, since the patient will begin to salivate and pull, and we would not like any of the saliva to, get into the back of the throat or even be swallowed by the patient. During this process, you'd also like to tell your patient to lean their head slightly forward, just to help this pooling go towards the front of the mouth. And once you start the top tray, again, dry the top of the mouth or whichever arch you're working on before placing in the tray. And once placing in the tray, you'll see that I ask our patient to bite down 3 times, just to make sure that the fluoride is, again, reaching every surface of the mouth. Once you take out the trays, remember to give the patient the saliva ejector, since you wouldn't like them to start spitting any of this out, especially right now. And once this is done, also remind your patient not to eat or drink anything for the next 30 minutes. For the next fluoride treatment, you'll see that I'm placing a cotton roll in the patient's mouth, just because she has a smaller mouth and I wouldn't like her lips to fall back down and put any moisture on the teeth, or have any of the varnish that I'm about to place on her tooth get on her lips, since patients typically do not like how this feels, since it's a little sticky. And of course, I'm drying the teeth again, just because I'd like the fluoride to hit every area of the tooth. Now I'm painting the tooth down with the fluoride varnish, since I'd also like to reach every area of tooth with the fluoride. Unlike the fluoride trays, I will be telling my patient not to eat for the next 6 hours. But for this, it's a little lenient, since really all that she really can't eat is hot foods, sticky foods, crunchy foods, hard foods, anything that'll really take any of the fluoride off her teeth. But for this next 6 hours, she will also not be able to brush or floss. And after I take this cotton roll out, her fluoride treatment will be complete.